Board of Health regular meeting Friday, February 21st, 8:30 a.m. Start with a roll call. Commissioner Caitlin Caldwell from Valley County.
Present.
Dr. Ryan Cole. Not yet. Dr. Greg Furch, Ada County. Present. Dr. Jane Young, Ada County.
Here.
Clay Tucker's here. Betty Ann Edelson,
Here.
Moore County. And Commissioner Crystal Rogers.
Here.
Thank you. Does anybody have any changes to the agenda? Anybody want to motion to approve the agenda?
I'll do that. So moved.
We have a motion and a second to approve the agenda as written. All in favor?
Aye.
Discuss and vote on the December 20th, 2024 Board of Health minutes. You can just do the minutes. Anybody want to motion to approve the minutes? December 20th.
Second.
Motion and a second to approve the minutes from December 20th. All in favor?
Aye.
Aye. Aye. Motion carries. Russ, you wanted to introduce somebody?
Yes, please, and thank you. So I want to introduce Stephanie Border. She's our new communications and marketing manager. So she replaced Maria Ortega. And Stephanie's been with us for a little less than 2 months. She worked a lot in the media industry and then more recently working for like engineering firms, doing a lot of public outreach around our public works, roads, bridges, public water systems. And yeah, if you want to share a little bit about yourself with the board, that would be great.
Thrilled to be here. I've been here a little less than 2 months. I inherited a great team and have been spending my last few weeks getting to know everybody, learning all about the programs. I'm very impressed with the people that work here. They're intelligent and passionate about what they want to do. And our goal will be to support that and get more people in the community involved in our programs.
Thank you. Yeah.
Thank you.
Okay, moving on to review the FY 2024 financial report. Laurel Gerhardt.
Thank you. So we're looking at, and Dustin will be getting it up on screen, the budget to actual report through the end of January, which is 58% of the way through the fiscal year. First thing I'd like to point out on this report is if you look at the top lines across for revenue, we're coming in at 57%. And for expenditures, we're also coming in at 57%. This is one of the first times since I've been in this role that those two things are balanced. However, it doesn't fully represent what's happening because we did have a lag in our ability to report fees accurately for the last couple of months. A little bit of a staffing shortage gap in having those duties covered, but we've gotten that covered now and are back on track with getting things reported accurately and where they need to be. Conan's here today and he's working to get the team trained and everyone doing what they need to be doing. Usually at this time of year, there's about a 5% gap in our revenues and expenditures, with revenues coming in a little bit above where we plan to be and expenditures being a little bit behind. So this year's not a bad thing. We're balanced, but it's not as accurate as it typically is with that underreporting of fees. The other thing I would like to point out this. When we have our report through the end of January, we receive our second Ada County payment in February. We have received that, but as you can see, the county contributions are coming in at 40% of planned budget. By the time we meet again for the March meeting, that will be reported, received already, and that'll be back to where it normally is this time of year. For interest revenue, we overpredicted how much interest revenue we'd be getting this year based on the past 2 years of underreporting. So when we do our budget revision, which we'll be talking about next, we'll readjust that back down. But interest revenue has not been as high as it was the last 2 years. A little bit more detail on this page. So as I mentioned, fees are coming in at 55% of where we plan to be. Usually this year, we're about 60%. I look back over the past couple of years to compare that high amount showing in contracts under administration is from the infrastructure grant that we received from Health and Welfare. And then just a reminder there that that other category represents non-federal grants or fundings that we received this fiscal year that we weren't planning for at the beginning of the year. And explanation there with expenditures, personnel is coming in at 56% of planned budget. That's on trend with where we've been the past couple fiscal years, which is at this point of the year, we're usually a couple percentage points behind where we plan to be. Operating is coming in right at planned amounts at 58% overall. And then as we see over for expenditures, 57% of planned amount, which is really, really close to where we want to be this time of year. And I think it stays on trend with what we've been seeing with some of the increased planning tools that Conan has, that we're running a lot closer in both our revenues and expenditures for months. Moving on to page 2.
So on the interest, why is the interest less? Do we have less cash gaining interest, or the rates come down, or sure?
Yeah, we do not have less cash gaining interest. We have about the same. I went back when I was preparing talking points for today and looked at what we had for our cash balance and investments. Last year was just about the same. So we're receiving less interest revenue. And that's in the legislative accounts, LGIP, yeah, sure, that's invested. Moving on to the second page. As I mentioned, the fee amounts across the programs are underreported for this report that we're looking at. So Conan yesterday, using the first 5 months of the year and what we received in December and January of last year, provided me with an estimate of how much we think they're underreported by, and it's probably underreported by about 150,000. So if we were to have that, which we'll see by the time we're here for the March report, we would be right at or a little over where we were last year. Much of that is probably in the food programs. We do in December, January, receive the food renewals. So there's probably some significant underreporting in the food program fees, and then some distributed across family and clinic services as well. Our contracts are behind what we received for the last 2 years. Some of that is a reflection of reduced contract revenue for COVID-related work, which we anticipated. We knew that was going to be happening this year. Our personnel costs are under by about 9%. As we looked at on the first page with operating costs, we're right on budget there. And then our trustee and benefit costs and capital are over and under respectively. And both of those are expenditures that don't always come in a regular trend throughout the year. It could be throughout the year in increments.
Laurel? Yeah, would you expand on that? What is that?
Which one?
The trustee and benefits.
Trustee and benefits is money that we sub-grant to others to do work in the community for us. So, for example, if we have a tobacco cessation program and we contract with somebody to do that work in the community, that would be categorized as T&B costs.
Okay.
I ask another one.
Mhm.
So on the licensing, whether it's food or childcare, maybe I should know this, but do those renew all at once annually? Like for our state licenses, they went to a system where they renew on our birthday. So it's staggered, the renewals are staggered through the year. With these kind of licensing, is it?
For food programs, I know for sure it's annual. They're due by the end of the year, by December 31st. If it's after that, we assess a late fee. For childcare, I'm not sure if that's staggered.
They're staggered. So with the food, we expect a chunk of change at
Yes.
one time. Okay.
And moving on to the last page, our cash balance statement. seeing the same thing we saw at our last meeting, balance about 9.5 million. Most of it is either allocated to restricted or designated funds. We'll do our normal special projects update. So for our environmental health system upgrade, this has, we've talked about, been a slow start. But just yesterday, Curtis got the email that we have been provisioned with our licenses in the new system. And then last week, we got a list of about 40 trainings that our staff who are going to be on the gap analysis team need to complete. So they started working on those just to familiarize themselves with the new system before we start assessing how our current system compares and can perform that gap analysis and begin moving over to the new system. So we're excited to actually have the training that we can do, have the licenses for the new system. We can start playing around in it, seeing how it functions, and then begin the big work of moving over to the new system. So by the March meeting, we will see more charges there, and that'll be for staff time, not so much for the cost of the implementation itself. We're not at the point of having received those invoices yet. The employee retention incentive was all paid out in the first paycheck in January, and on behalf of the staff, I'd like to say a big thank you to the board for continuing to support that. It makes a big difference, and we're thankful that we're able to receive that in the first January paycheck. Our staffing needs, we have a couple of those positions that we were able to fill. The Valley County Home Visitor for Parents as Teachers program and the additional Ada County Home Visitor have both been hired. And they started charging to it. So we'll continue to see that amount reduce as well over the next few months. For Armstrong bathroom remodel, we went out to bid again, as we've talked about, and we're hoping to have more than one bid in this time. This is the second time we went out to bid, but unfortunately, we did only get the one bid in on the bathroom remodel project. It was less than we got the first time, but still didn't seem like what we were anticipating for remodeling the 4 primary bathrooms in the building. So we've decided to wait till we at least have one other contractor to compare to. We are going to try to go out to bid again late spring timeframe, and maybe include a couple of options for contractors to do just 2 bathrooms instead of all 4 and see what they come in with for pricing. And we're also going to advertise it more broadly, put it in the newspaper, and see if we can get more contractors just to respond to the bid. We just didn't feel comfortable going with only one bid and no basis for comparison.
Mr. Chair, if I can ask, well, what roughly was that bid? Do you remember?
320, 330 for 4 bathrooms, and it is just not just a cosmetic upgrade, but not any new plumbing or expansion or anything like that. So it seemed quite expensive.
Need help.
Next time. That's right. Be watching the newspaper. You'll look up there.
Like you have time in your hands.
So this is pretty much cosmetic rather than plumbing issues and everything.
There are some plumbing issues. Some of the fixtures are old, so there's some toilets that leak that don't flush well. There's gaps between the doors that don't close all the way. You know, you kind of see when people are going by, some things like that that are just not as comfortable. And then older, the doors all have paint scratched off them and things like that. So some of it's cosmetic and some of it's functional as well, but they're all at the point where we continue to need to make regular plumbing calls for each of the bathrooms, leaky shower, leaky toilets, flushing issues. So those things are happening as well, but largely cosmetic upgrades as well. And then the McCall office refresh, what we're looking at doing there is paint and carpet and some new signage. We'll be meeting with them. We have a new office services supervisor in McCall. So we'll be going up to meet with her in March, April timeframe to talk about the timing of that and exactly what we want to do for the office. No cost contributed there yet. Then personnel reserve, we've got about 280,000 there. operational reserve at about 4.5 million, capital reserve the same at 1 million, which brings us to total reserve fund designation of 6.5 million. And then we've got restricted funds of just under 4 million. That does bring us again for the second report in a row of what appears to be a cash deficit, but we know we've got the 9.5 million, just a lot of it's set aside in that restricted or reserved funds. And once the Ada County payment is included in the budget, that deficit won't be there. Or line item than actual deficit of cash.
So there's enough for pizza party?
I wouldn't quite go that far. You can check our meal and refreshment policy and see if it meets the criteria.
We're gonna fix the plumbing first.
On the staffing needs, you have everybody hired that needs hired.
There were a couple of positions in that we requested. One was a behavioral health provider. And since Beth has started, she's doing an analysis, a reanalysis of what the staffing needs are there. Is there better utilization of our current behavioral health provider that we can do? Do we need another nurse instead? So we're doing a little bit more analysis before we post and hire for that role, recognizing the importance of behavioral health, but wanting to make sure it's the right fit for the FCS team. And then the other CDH staffing needs there were a half position that was funded most of the way through the year with a grant that was just continuity for the rest of the year for that position while we figure out what we'll do for next fiscal year. That was all the staffing needs. So there was only one that we haven't hired.
Is the demand going up or over here?
For the behavioral health. Beth, I'll let you answer that if you're.
Yeah, based on the referrals that we're getting, we're meeting the demand today. I think there's still a need in the community. And so we're working with Stephanie on marketing and evaluating how we can get more folks to know that we're providing services here.
Thank you.
Any other questions for Laurel? All right, we'll move on to our next action item. It's discuss and vote on the FY 2025 budget revision and reserve fund designation. This is also Laurel.
Yeah. So this is just a quick summary of the budget revision that we're requesting, again, together by Conan and team. Overall, we're looking at a budget decrease of about $700,000. We're requesting a reduction of just over 500,000 in personnel as we've reduced our FTE count since the budget proposal that we did, budget that was approved. Those were COVID fund supported positions. We talked about the reduction in contracts for COVID related revenue and accordingly reduced FTEs there. And then there were 2 administrative support positions that we've been able to reduce this year as well through increased efficiencies. So looking at that 500,000 in personnel reduction, an increase or a reduction of 500,000 in operating as well. And then increase of 20,000 in capital outlay and 348,000 in trustee and benefits. And that's funds that we subcontract out to the community to help with the work that we're doing. The corresponding decreases in revenues are about 430,000 in contracts. Those were the COVID funds, COVID related work. Reduction of 86,000 in anticipated fee revenue. An increase in 72,000 in other funds. Those are the non-federal grants. A decrease of about 152,000 in interest revenue, as we talked about in the budget to actual report. And then we're also expecting to use 109,000 less in our planned use of our reserve funds. That's the summary. And then the second page of this just goes into the details by division. So you can see broken out by division where those decreases are occurring. So for revenue, the fees were reduced in both community and environmental health and family and clinic services. For other funds increased for support services. And then we have a decrease for family and clinic services. our planned decrease in interest revenue, decrease in the amount of restricted funds that we were planning to spend, and also a decreased use of reserve funds brings us to that overall decrease of 705,000. And then same for expenditures. You see the decrease in personnel across divisions, a decrease in planned operating, and then again, the increase in capital and T&B. That together equals a reduction of in expenditures of 705,000. And I'll stand for questions or ask for the board's approval.
Mr. Chair, would you comment more on the reserve fund reduction here? So we have several categories of reserve funds. What does that actually mean?
So when we put the budget together at the beginning of FY25, we were planning to use some of the reserve funds to augment our normal budget. As it turns out, we've needed to use less of that than we planned to do.
Okay, I'm still a little bit confused here because we have personnel reserve, operational reserve, capital reserve.
And Conan, do you have broken down by which reserve funds are less impacted or which we'll be using less of for budget revision?
I don't have that. Maybe that.
Thank you.
Just the main reduction is based on the receiving less COVID funds than we planned to at the beginning of the year, and then the according reduction in FTE.
On the interest earning change, are you projecting that interest rates are gonna continue lower throughout the year?
We have projected that, yeah, we'll be getting about the same in interest as what we did for the first 58% of the year. So keeping that trend line the same, we at this point aren't projecting that it's going to go back up in the direction or the amount that we were seeing over the last couple of years.
Anybody else?
So the net effect is if I'm understanding this right, the revenues are going down.
The revenue that goes down is that we didn't receive 2 contracts that supported COVID related work. So it's just comes to us from health and welfare. We didn't receive them, but $700,000 less in what we.
And so we're adjusting down the expenditures at the exact same
Yes.
amount. So overall, it's
Yes.
a
The same.
push.
Mr. Chair, this may not be an appropriate time to ask this question, but I would like an update sometime in the near future as the huge amounts of opioid funds that we're receiving. What are we doing? Where's that stand?
Yeah.
So,
We can do that.
okay.
Any other questions on this? Before we None? Would anybody like to motion on this?
I move that we accept the budget revision as presented.
Second that motion. We have a motion and a second. All in favor? Aye. Motion carries. Okay, are we good on time?
Good. I'm good.
Okay.
That is good.
The non-municipal solid waste oversight. Curtis Lovelace and Mike Reno.
Thank you, Mr. Chair. We wanted to present to you today some information regarding our solid waste management plan and the work that we're doing there. And Mike Reno, our program manager for our environmental health land team, is here to share some of his experience as well. And Mike is considered an expert and a subject matter expert across the state in these areas. So we really value his opinion and his knowledge and experience. So thanks, Mike. Appreciate you being here as well. All right, so I'm gonna start by giving a little bit of background on solid waste. So Dustin, you can go to the next slide. Okay, so there's really two different distinct types of solid waste that we deal with. First off is regarding municipal waste. This is governed by the Solid Waste Facilities Act, Title 39, Chapter 74. And in this specific act, health districts have statutory requirements to do specific things in regards to the operations, the closure, and the post-closure activities. This is spelled out in the act, exactly what health districts functions they perform and how they interact with the facilities in this type of setting. That is different from the non-municipal solid waste. The non-municipal solid waste is governed by DEQ Rule 580106. And in this rule, in this state rule, there is no health district requirement or role in non-municipal facilities. So that's a key difference that we need to keep in mind as we talk about this. And the thing to keep in mind also is that when we're talking about non-municipal solid waste, we're talking about everything that is not a landfill. So we're looking at transfer station, petroleum contaminated soil sites, composting facilities, and different types of facilities like that. Now, these facilities typically come in two forms: county owned and operated, and privately owned and operated. And we're going to talk about the difference between the two here in just a minute as well. So that's a little bit about the legislative background, the difference between the two, and what role the health district plays in both. So for municipal waste, in the Solid Waste Facilities Act, we have specific roles outlined. For non-municipal solid waste, governed by the DEQ rules, there is no reference to the health districts or requirement or role for the health districts to play. All right, Dustin, next slide. So then the issue that is occurring is currently for the last 30 years, we've had a memorandum of understanding between the Department of Environmental Quality at the state level and the 7 health districts throughout the state. And in that MOU, the health districts have been assigned the same roles and responsibilities for both municipal solid waste and non-municipal solid waste. Even though we just outlined that based on the act and the DEQ rules, there's differing types of responsibilities that the health districts have with no responsibilities for non-municipal waste. However, that's not spelled out in the MOU, and that creates some problems that we have started to encounter, specifically between the privately owned non-municipal solid waste and the county-owned non-municipal solid waste facilities. Now, I just want to be very clear. We are not experiencing any of these concerns that we're about to express with the county-owned facilities. The county-owned facilities traditionally have not caused any kind of issues. We've worked very closely with our county partners to manage those and resolve those and work through any of the issues. And so we appreciate that partnership with the counties. But I'd like to let Mike explain some of the things that are going on with some of the privately owned facilities, as his team has spent a great deal of time working with them and encountered some issues that we would like to try to figure out how to address. So Mike, over to you.
Okay, Mr. Chair. So getting back to what Curtis was initially talking about, when the Solid Waste Facility Act was created, the counties had a lot of input in that, and they basically didn't want DEQ in their daily business. So they put the health districts in charge of operations, which is the day-to-day stuff that goes on, closure, post-closure. What we've been experiencing with these privately owned facilities, and there used to not be an issue because there weren't any. But now we have these privately owned facilities like these composting facilities, these construction demolition sites, and we get a lot of complaints, specifically with odors. And so a few years ago, DEQ's air quality program took themselves, as part of the Regulation Reduction Act, they took out all their responsibilities to deal with odors. In the past, when we had odor complaints, DEQ would go out and take care of it, but now they don't do it anymore. So it all gets dumped on the health districts. And even DEQ on these facilities dumps them on the health district. So one specific example would be Timber Creek Recycling, which is in the technically impact area of Meridian. Meridian approved it. When they initially started, it was just a composting facility that operated and it was fine. But then they started signing all these contracts with, for example, Sorrento, the cheese waste. And they started taking this food waste, what they were calling food waste, when it's actually WAS, which is a industrial waste that is generated out of the cheese whey. And it is the most raunchiest, nastiest thing you've ever smelled in your life. And so it started coming out to their facility. They started getting complaints. And so everybody was after us to go out and do something about it. So we tried to work with the facility, tried to get Meridian code enforcement involved, and they didn't want anything to do with it. We were just beating our heads against the wall. We were about to the point where anytime that we have to do enforcement against one of these type of facilities because they're not complying with their operating plan or their odor management plan, is we do a referral package to the DEQ. So we tried to do an enforcement referral to DEQ because they have the AGs who can go after these. And they asked us to give them a warning letter. So we did a warning letter, and then they still didn't comply. And then all of a sudden they came up with their extension of their facilities approval with the city of Meridian. So they started working with us, trying to resolve the issue. But as soon as they got their approval, it's been crickets, and we started getting complaints again. We actually went to the city council, Lori Padigian and myself, and tried to speak out, with the problems with this facility. And we were basically shut down by one of the city councilmen. We tried to explain that they were out of compliance. He was hung up on the fact that we didn't issue an official notice of violation. And we don't do that for solid waste facilities because the AGs have come down and said, if you issue a notice of violation, then you, the health district, take all responsibility for enforcement. You got to use your own attorneys and everything else. So we never issue an official notice of violation. We just do the referral package. Since they got their approval, they've been getting complaints again. So we contacted Meridian Code Enforcement, said, hey, you guys need to go out of these complaints. And they said, their response was, we don't investigate complaints against an approved use. We're going to refer them all to the health district. So we responded back, said, we're not the odor police. You approved the use, and therefore, you need to be the one investigating it. And that's where we've run into a lot of issues with these. An example of the issues we run into with these privately owned ones. County-owned ones, we never have any issues. If there's something we identify, we talk to the county commissioners, it's rectified immediately. But these private facilities, we end up spending so much time. I mean, we finally did a referral package to DEQ, and it was about 2.5 inches thick with all our documentation, all the emails, all the meetings and everything else that's associated with this. And the other big time issue associated with these is when we're getting to where we're doing the referral, we're in meetings all the time with DEQ, with the facility. It just takes up a lot of time, and we don't get paid anything for it. So all this is being funded, all our work on these private facilities is being funded by the county's contribution to our budget, which we feel is inappropriate use of funds. And so, do you want to talk about the solution, or you want me to go into that?
No, go ahead. So next slide.
So our solution is to change the MOU between the health districts and DEQ to give the privately owned non-municipal solid waste facilities back to DEQ, to say we don't have any responsibility for them. It's because under DEQ's rule, DEQ is the one responsible for these facilities. We'll continue to inspect all of our county-owned non-municipal solid waste facilities, like the transfer stations. There's 4 in Boise County, there's 1 in Valley County, and there's a number of county-owned facilities in Elmer County as well. But these private ones, specifically, the majority of them are in Ada County. And I think there's one in Elmore County right now. We want to give those and the responsibility for managing those on a daily basis back to DEQ.
Um, Giving is only one side of the transaction. What is the response on the receiving side? Or is there cooperation in that? Are they willing to take it then and reassume that?
Mr. Chair.
Go ahead.
Yeah, so the 7 health districts have discussed this internally amongst ourselves with the district directors doing that discussion. The 7 health districts have agreed to a revision of the MOU with the Department of Environmental Quality. We do have a district director liaison that works directly with DEQ that will be bringing this to them and working through that process with DEQ of the potential revision to the MOU. So those are negotiations that are currently taking place and that are in process right now. And then additionally, there was recommended legislation where DEQ is going to bring forth rules that would make changes like this. And then that legislation seems to have been pulled and is no longer moving forward based on what we've heard from the director of DEQ. However, the health districts would still like to continue moving forward with these revisions to the MOU, even if there isn't legislation to align with it. So since there's no longer legislation moving forward, our next step is then we'll just work directly with DEQ to revise our MOU to exclude the privately owned non-municipal solid waste facilities from the purview of the health districts, because we don't have any legislatively anyways.
So obviously the citizens around these are being affected. Are there fines that can be levied against the offenders, or is that in state law where the Attorney General's office can, through the state law, go after these individuals if they're not going to comply? I mean, if they're not being good community citizens and not abating the problem, what enforcement? Obviously, we're trying to get DEQ to help. What incentive is there for these private facilities to comply?
Mr. Chair, in our conversations so the health districts don't have any authority against any facility. So it relies on DEQ. And in the last meeting I had with DEQ and Timber Creek Recycling, DEQ was of the stance that it's the entity that approved the conditional use for this facility to operate who is the responsibility, which in this case would be the city of Meridian
itself.
So we ran into something similar with the privately owned municipal solid waste facility in Elmore County, IRWS, when we were having issues with them. And in the end, it was the Elmore County who had the hammer for enforcement, because they are the ones who issued the conditional use for them to operate. The health districts don't issue any permits. We approve the operating plan, and then we make a recommendation to either the county or city who has authority over the facility, whether we agree that yes, everything's good to go here. You can issue the conditional use to operate.
And I know, Chairman, with our issue in Elmore County, which is probably maybe the biggest issue in the state, that and being the city of Meridian, the county really doesn't have a say on what the city does. So city of Meridian does, approve something, then the county commissioners really don't have any, yeah, because the CUP was issued by the city. In our case with the county, our experience is Central District Health, obviously the monitoring, aspect of it has been instrumental in making compliance with that CUP. And we really felt that DEQ was lacking in the enforcement, and that's who had the teeth in the game. So we took it upon ourselves to legally, and notice the violations. But once we do that, then the county is responsible for that. He is correct. And so, but we had to do that as a county. But in this case, if the cities aren't, it's definitely hard. Because obviously Central District Health has, county backing and funding, but when it's a city, it does make it difficult for you guys. We really didn't get a lot of support from you. And we even had meetings and they do have the AG, aspect of that, but they weren't really willing to do anything about it. We have to.
Wasn't this one of the topics at the association meeting in Idaho Falls? And I don't know, maybe it's my impression, but I thought that he was a little resistant to taking it back. Did I misread that? Apparently the negotiations are open and there's cooperation going back and forth that will ultimately end in a new memorandum, is what I'm hearing you say, correct?
Mr. Chair. Yeah, to my knowledge, that's the case. There, at one point, there was the idea that DEQ would carry legislation in this legislative session to make these types of changes. At some point in time, DEQ decided they weren't going to do that. We've then, as the health districts then discussed this amongst themselves, decided that we wanted to continue to work out this issue with DEQ by having our district directors work directly with the director of DEQ to revise and redo our memorandum of understanding.
So once the idea of legislation kind of went fizzled, they were then still willing to come to a solution and have them be the hammer in this.
Mr. Chair, I believe we are trying to discern that right now and figure that out, that we are in process of those conversations right now.
Mr. Chair, the initial legislation that DEQ was going to put forward was to take the health districts completely out of all solid waste. And the thought behind that was because if we had to do enforcement against a county facility, how do we do enforcement against a facility owned by the county when the county is providing us with our budget? But DEQ backed off on that. As far as the non-municipal solid waste, those are DEQ rules. So they don't really have a choice in the fact, if we want to give it back to them, they have to take it. They can sit there and turn around and they can contract with the health districts to go out and do those annual inspections for them. And that way we're paid to do that rather than the inspections and all the time we spend on these facilities coming out of the funds that the county provides us.
So I'm just curious. So obviously there's some political wrangling between the entities. But at the end of the day, I'm going to go back to the citizen and these private facilities. Does it fall on the private facilities to come up with an intervention to abate the odors? Or do we give the recommendations as to what they should do, but they still have to do it? And what are they doing, if anything? Do they use lye? Do they use baking soda? Do they cover all those different things?
Mr. Chair, yeah, with the example of Timber Creek, when it was coming down to where they were trying to get renewed through the city to extend their operating time for a few more years, they proposed adding lime to the process. It was suggested they do that at the facility. So when the material comes out to the site, that it has the odor knocked down somewhat. They did some testing. They were supposed to get some equipment. The equipment still hasn't been delivered and it's been 4 or 5 months, so they haven't input the process. Once they, like I said, once they got their approval with the city to extend their time period at the site, they quit working with us on that. We always try and work with the facility in whatever aspect the issue is, to try and come to a solution, trying to resolve the issue. But when we get to a point where we're just beating our heads against the wall because they're not helping, or trying to resolve the issue, then we refer it to DEQ for enforcement. As far as this facility, because the city issued the conditional use to operate, the recourse for the private citizens is to complain to the city, and their code enforcement is the one who's required to go out there and do something about it.
So it's an accidental Gorgonzola party that nobody wants to go to.
But their code enforcement is unwilling. You know, we even had the city attorney at some of our meetings trying to get their code enforcement to go out and do anything, and they are reluctant to provide any assistance whatsoever in resolving this issue.
Mr. Chair. Mike, you could kind of catch me up on what are we doing with from commercial poultry up through large animal, dead animal disposal? Is that mostly composting now?
Mr. Chair, a lot of them is composting. You know, the certain landfills have areas where they can take dead animals. There's actually some guidance on specifically the mad cow disease animals or the chronic wasting disease animals that go to a landfill, that they take them and they put them in a specific location. But as far as you know, Darling has a facility out south of South Boise, and they take dead animals and they render them out there as well. And so you do get some.
So I know, because we have, of course, Simplot's feedlot in our district. And I don't know if they're still with Darling because they have a huge dead animal issue. And some of our big dairies are composting in our county now, but I didn't know.
Yeah, so Department of Ag would be over that, over the dairies and what goes on out there, as far as the dead animals, because it's considered a CAFO, a confined animal feeding operation. Once you get to a certain level of the number of animals, then it falls to the Department of Ag to have purview over those.
Who's leading the negotiations on the memorandum of understanding?
Eric Kettner, he's the director from Panhandle Health District out of Coeur d'Alene.
Any other questions on this?
Mr. Chair, one last question. To your question, what's the timeline in terms of DEQ taking responsibility back? I'm going to go back to the citizens that don't want Gorgonzola in their windows. How long do we think the process will take in terms of the negotiating?
Mr. Chair, so as I think was mentioned, each district director, we accept responsibility for all the various areas of services that health districts deliver. So in this case, environmental health, DEQ work, the director from District 1 has accepted that. So I've offered to assist because I'm local, know Director Byrne pretty well. So next Tuesday, we should get an update from Director Kettner on the conversation he had with Director Byrne. And, you know, I would be hopeful this could move forward pretty quickly on our end. Mike has already made all the revisions to the MOU that he discussed. It's ready to go. All the directors have approved that. Realistically, what typically happens when it goes to a state entity, they have the AG's office reviews it. So I'd be hopeful that we could get this done and be able to share this with you by the May Board of Health meeting.
Yeah, once it gets warm again, I believe it's more important.
Right, yeah. Yeah, the pressure will be on once well, it's already starting to warm up now this weekend. So yeah, it's a little bit of a lengthy process. And I reflect back on like, why did we accept this in the first place? But prior to House Bill 316, which changed, you know, it actually removed state agency directors' authority to delegate these responsibilities to us. So envisioning 30 years ago, when they had the authority to do that, they were able to pass anything on by law to the public health districts. Well, that is no more. So that's where we have the MOU for things like this. And now we have more leverage. And I think with all 7 districts being on board, you know, it's not so much up for negotiation. This is really our strong preference and how do we get there? But it will take some time. Sure.
The end product is one MOU with all districts the same. That
Correct. It'll be signed by each of the 7 health district directors and the director of DEQ.
anything else on that? Thank you. All right, moving on to our IT security presentation. We have Laurel Gerhardt and Hetzel.
Thanks, Mike.
Just quickly introduce Kent Petzold, our IT manager. He'll be presenting on the current state of cybersecurity at Central District Health, and with some recent hacks that we've heard about, the timing would be good to just let you know what we're doing to protect our information. And well, with that, I'll hand it over to Kent.
Okay, next slide, Dustin. So I got this information from one of the leading cybersecurity vendors out there last year. As you can see, the top 3 there are education, government, and healthcare had 75%, 43, and 47% increase in attacks. Unfortunately, as a health district, we kind of fit into those top 2, or top the number 2 and 3, government and healthcare. So there's a lot going on. Recently in Eastern Idaho, one of their school districts had an issue with ransomware. So there is a lot going on. Slide. Next slide. So I'm going to kind of go over some high level things that we're doing. I don't want to get into too many specifics because if there's a bad actor out there, they know what we're using. Might be easier for them to do what they want to do. Anyway, we've got policies in place for minimum password length, which I think at this point is 12. Requires uppercase, lowercase, special numbers, and our numbers and special characters. Last year we implemented multi-factor authentication. So going through your email and our VPN, you have to have multi-factor. If you're on site, you don't have to do it every time, but if you're off site, you do have to do multi-factor every time. And as you know, if you get into your bank account, a lot of them are doing the same thing. So we also created a conditional access policy. If you go outside the United States and try to get into your email, you will not be allowed. So we can put exceptions in for that, and we have management has left the country and needed access, but usually when they get back, we take that away when they get back. We also have a password management tool that a lot of this staff use. And the one we use is actually one that hasn't been hacked and lost all your passwords. Like there's a couple out there that have been hacked a few times and passwords have been part of that hack. So next slide. As far as our network, again, we actively block any traffic from outside the US. Sometimes that becomes a help desk ticket for us because Some websites will be served up out of the US. They might fail over to a data center in Canada, and all of a sudden you can't get to it. So we've had to open those up as we find those, but essentially we block everything outside the US. We do have our endpoint protection on all computers, laptops, and tablets, blocks malicious software from being installed, does other alerts for things that shouldn't be happening on your computer. And then on our firewall, we only open ports as needed and block all non-business related sites. So any type of file sharing, things like that. We do work with a vendor that helps us go through all our logs and data. This report is from last Thursday, so it's the 10 days prior to last Thursday. We had 67 million that they looked through, 903,000 events, and we weren't alerted on anything in that 10 days, but we do regularly get alerts from them. A lot of them are created by us in IT, and they're actually alerts that they tell us we can suppress, but there are also things that if a bad actor got in, we want that alert, so we just let it go. And we just let them know that, no, we did that, that's fine. So
What's the 930,000 events?
So as part of our servers and stuff, in the logs, they create events like when you log in, when you access this or that. So they see all that and parse through it and know, if it's normal or if it's looks like someone's trying to evade and do something malicious. Next slide. So as part of this, we also have security trainings that go out bi-weekly. Right now we're at 59% completion. Dustin and I went through that the other day, and it's probably a little low because we still have quite a few people in there that have either left or no longer here, maybe did part of them. So it's probably a little higher than that, but we need to get more people completing their trainings. We do active phishing simulation. Our 1% click rate also is a little misleading because we've done this for so long that people recognize it and just delete them. So they don't actually report them as phishing. And then of the people that actually did click them, we have that 80% is actually one person that didn't complete their remediation.
You're not telling us a fish story, are you?
Fishy story.
But the one thing with this newer security training that we're doing is that they're shorter videos. They're very to the point, talking about, if somebody calls to change their bank account or anything, it's like, do your checks and balances. It's kind of like if you get a text from your bank, I always go log in. I don't ever click anything in the email or from the text because while it might be valid, I don't know. So next slide. So kind of our roadmap is I went through a security audit with a vendor, and it was just asking questions about what our policies are, what types of things we're doing. We got some to-dos through that, but once I get through that, with the help of my team and Laurel, we'll strengthen some of our current policies, and we'll probably be adding some new policies as well. When you get into HIPAA compliance and things like that, your policies kind of drive a lot of how you're HIPAA compliant or what happens when things go awry. We're gonna put in some software that does what they call data leak protection. And it keeps sensitive data from being sent out. It can be a little tricky for us as a health district because with our EPI program, they share between health districts. Even with the clinic, they share data. So we're gonna have to make sure that, you know, when they're sharing data, they can share that appropriately. And, but for others, if they're sharing data that shouldn't be shared, that it's stopped. Also, probably sometime next year, we'll do, I think they did a penetration test before I started over 3 years ago. So we'll probably be doing another one next year sometime. That's where you have somebody come in, they try to get in through your firewall. And then you give them access inside and they try to traverse inside. They give you a nice little report of things you need to fix that they can do. So it's a good measuring tool and a good way to get to do so to ensure your environment's safe. And then we're also going to shore up our compliance and auditing about, you know, everything that goes on, make sure people are doing their trainings, people are compliant with the policies and like that. So okay. Pretty quick, but next slide. Question?
Mr. Chair, we back up every night at that mountain home that we.
Yeah, we do backups. Our environment, try to keep those up to date. It's one of the things we'll be reviewing here as well.
Any other questions? Thank you.
Thank you.
Thanks.
Nice to meet you.
So we're a little bit ahead of schedule. I think we could take a quick break before the parents as teachers, give them time to come in and get set up. Yep. Okay.
And I think my intermittent fasting alarm going off so I can try a cookie now.
Yours goes further into the
Okay, coming back from break, we have a parents as teacher team presentation. Melanie Quas.
Hello. Even from parents as teachers, are all of you familiar with the program, or is this first time hearing about it? First time, very exciting. Well, we are a home visiting program. We work with families that are prenatal all the way up to the kids going to kindergarten. If there's multiple kids in the family, we'll see the other kids as they grow as well. So sometimes the families stay in the program for quite some time. So I'm going to do a quick little introduction. We're waiting on a few more, but we have some home visitors that live in other counties like Elmore and Boise County and now Valley County. So that's exciting. So our Idaho City gal, she might be here in a little bit, but I'm Melanie. I am the I was a home visitor, so I'm just used to saying that. I was a home visitor for 5 years and then recently stepped into the program manager role. And I've asked my staff to be here today, and I wanted them, after they introduce themselves, to say one little special thing that they love about our program and home visiting.
Hello, my name is Carol Russo. I am a home visitor here in Ada County, and I just recently became lead home visitor, and I supervise our staff in Elmore County, Boise County, and now in Valley County.
Hi, I'm Millie Bella. I'm a home visitor in Elmore County. And I think one of the best parts of our program is helping parents learn to advocate for their child's needs.
Hi, I'm Jessica Kelly, and I'm brand new to the program. I'm a home visitor here in Ada County. And I think the most important part of our program and what I've learned before in my past experience is connecting family to those resources and helping support them find those resources that they need.
And I forgot to say what I really love about it. What I really love is seeing our families get excited when their child reaches a certain milestone. We get calls and people are really eager to tell us what their child has been learning and what they've reached since our last visit. So seeing parents get excited about their children's milestones is really rewarding.
All right, so we'll go through what the program looks like.
Next slide.
Next slide, please. This is our team. There's a few of us maybe trickling in, but it's really grown, and that's really exciting. When I started, it was just myself, one other home visitor, and our supervisor. This does not even include our new Valley County, so that's really exciting. Each of us see around 18 to 20 families on our caseload, unless you're in a rural county, and because of the commute and driving to and from families, we typically keep it around 10 to 12. And then each family typically receives 2 visits a month for an hour in the privacy of their home. Next slide. Who we are, we have been an evidence-based visiting model backed by 38 years of independent research with proven outcomes. We like to increase parent knowledge of early childhood development and improving parent practices. We provide early detection of developmental delays and health. We prevent child abuse and neglect, increasing school readiness, and improving maternal and child health. So this is the main goal. The curriculum that we use is evidence-based, and Parents as Teachers has been around for over 40 years now, and it is nationwide. Next slide. So this is our goal and our vision. When we talk to families that might be interested in the program, we really like to focus on the fact that we are going to be working on the child development and looking at milestones and maybe potentially seeing some early intervention that might be needed for these children. But it really is focusing on the family well-being. So we come in and we support the families however they may need. If a family is stressed about income or shelter or food, that impacts their parenting, and that ultimately can impact the development of their child. So we like to look at the whole scope of what is going on in a home because we understand the importance of the well-being of the family. That in turn will help with child abuse and neglect, which is one of the main focuses, and getting children out of cases where they might be in protective services. So this is a way to help, encourage positive outcomes. Next slide, please. So this is a little glimpse into our daily life. We get on the floor and we get messy and we have a lot of fun with our families. It really is all about learning through play when we follow our curriculum. Even though we might be talking about things like discipline or potty training or nutrition or safe sleep, how to handle stress in ourselves and also with our children, we can do that through playing. So even though we might look like we're finger painting, we're talking about with the family, all the things that the child is learning, and then also supporting the family with whatever they might need. Next slide. Once a month, we do something called a group connection, where we bring all of our families in our program together, and we provide an opportunity for all of them to connect. The children can interact. That top one there was we went to something called Bugs, and it's in a garden, and they got to play and dig in the sand. We've been doing something every around Halloween. We do a trunk or treat, and so we actually do it here at CDH, and we ask all of the other departments to come and join. So like First Teeth Matter come, WIC, immunizations come, and we do a trunk or treat for our families. So that's like a fun little one there. So it's a really great opportunity for families to connect that they might not otherwise. And it's always a free event. So it is nothing that will cost the families to come. Slide. A big part of our program is doing screenings on our kiddos. We use Ages and Stages, which is our ASQ. And this is something that we do about every 6 months with our kids to make sure that they are reaching their milestones. It is a great learning opportunity for the parents to see where the children can focus on. But then if early intervention, if it's noticeable, we cannot diagnose, but we can help refer. So we have a lot of connections in the community that we are able to do, encourage these families to either talk to their pediatrician or look into getting a further evaluation based on the screenings that we're doing. And we also provide hearing and vision screeners. And I wish Tanya was here.
I know, they're really great.
She is up in Boise County in Idaho City, and up there they don't receive a lot of services. So for her to be able to go up and bring a vision screening or a hearing screener, she's seeing a lot of things up there, and then that the families would have never known otherwise. And she's able to refer them, and they're able to come down to Boise and get their glasses or get their hearing aids. And that might have been undetected for who knows how long. And then that child struggles in school, and it can, it can be really tough out in the smaller community. So I'm so grateful for things like this where we can go and really provide access, to things that they might not otherwise know about. Our developmental screeners have been huge for our program. We see a lot of early detection, and so the earlier the intervention, the more positive the outcomes. And so I'm really glad that we're getting in to see these kids before they go to school, because sometimes they don't notice until they go to school, and then that's when it's a little bit more difficult to have the support that they need. So we're getting them in developmental preschool, we're getting them to OT, PT, speech, and getting them really prepared and ready to go to school with the resources and the support that they need. Any questions so far?
Mr. Chair, what percentage of your visits do you think both parents are involved?
That's a good one. I'd say like in the lower, like less than 50%. I don't have an exact number. I know Parents as Teachers really focuses on wanting both parents there. So if the dad is involved, we really highlight that. But I'd say it's probably in the 20 to 30% where both parents are involved. But that doesn't mean that the other parent isn't involved, but
Right.
they might be working.
Right.
Mm-hmm.
They've been at those group connections too.
Yeah, they come.
Yeah, they do come to the group connection. And sometimes some of the visits are with mom and some of the visits are with dad.
Or grandparents. We also
Yeah,
work
we
with
also see grandparents.
Child Protective Services. So sometimes we are working with foster parents as well that might be in the process of adopting or getting reunification with their birth parents.
Dr. Cole?
Just kind of a basic question. How do you find the families, or do they come to you, or are they referred through visits here? And then my second question would be, do we have for our more vulnerable migrant population, do we have bilingual opportunities for some of them?
Sure. First question is we get a lot of referrals from WIC. So they come in, they learn about the service. Word of mouth is really huge. Like families love this program, so they'll tell their friends. We do get some referrals from St. Luke's. I did a presentation with Full Circle Health, so they're familiar with us. Health and Welfare is another one. We partner with Infant Toddler Program, and we also partner with like children's therapy place. You know, therapies all know about it. So right now we have actually a very long waiting list, but that's why we brought on one additional, and it's a good problem to have because it's like, you know, we know that we can hire new home visitors. We're going to be able to reach more families, but the referrals are coming in plentiful. So that's a good thing. But also to answer your second question, we work with a lot of refugee families and we have interpreters. We have a couple bilingual staff here. We just hired one more that speaks Spanish, so that's really nice because to reach that population. And then we use a system called Proprio, which if we needed to call in an interpreter, we'd be able to do that. But I had a Pashto speaking family for years, and I always had my Pashto interpreter with me. We hired an ASL interpreter to come to one of my families because, you know, she was nonverbal, so that's really helpful. So luckily, CDH has been really supportive in having interpreters available. So we're reaching Arabic.
Arabic, yes. I had a lot of Arabic families, and our Arabic translator, she became like a family member
Yeah.
to a lot of our families, and she was definitely an essential part of our visits. So we're really lucky about that. And then as far as Spanish referrals, Millie, myself, and our other home visitor, we kind of tackle all of the Spanish speaking referrals. We did.
Sure. Can you just fill in backgrounds for me or educational, and if I missed it, are you social workers or what kind of credentials?
We do open up opportunities for non-bachelor holding positions, but all of us currently have a bachelor's degree. Mine's in speech and hearing, hers is as well. A lot of child event, you have social work.
Mine's in social work. I have my licensure through the state as well.
And I'm sociology and associates in criminal justice.
So for our home visitors who do not hold a bachelor's, they are service and family coordinators, but lots of experience with working in the schools, and especially in special ed. All of us have a big special ed background as well.
Yes, and child development experience underneath us. I used to work for a school district for 18 years with children with disabilities, and so we did a lot of support in that, and a lot of that experience has helped me in this new position.
So we're all technically developmental specialists is our title, coming from background, but also when you go through the program, there's an extensive training involved as well to learn the curriculum. Yeah, this is fun. We do a lot of resources. This bottom picture here is Shop with the Cop. So we've partnered with the police department and they give us 2 opportunities a year, which is just, it's such an incredible partnership. During the summer, we go and we meet up at Dillard's and they take on a kiddo and they go shopping with the family. They get them school supplies, they get them clothes for the school year. And it is magical. These kids, you would not believe the joy that you see coming from these kids when they get to go shop with the cop. So that's really fun partnership. And then they do something at Christmas with us as well. And we select our families. You know, we want to make sure that this is reaching the families who are truly in need, who really will value this, and it's going to make a big impact on their life. So those are things that we do. This top one here was a library event. We do a lot of, or no, that was here at CDH. We brought them here at the CDH to do
things
an activity, but we do partnerships with the library. We Shop with the Cop is a big one. We've done it with the botanical gardens where these families wouldn't normally be able to go and do the lights at the garden aglow, but we get tickets for them. And that's really special for them because maybe the family wouldn't be able to afford something like that. So we try to really outreach and get opportunities for our families. We just had one at the YMCA where we were able to use the Thrive Room, which is a sensory playground. And they let us come in for free, and then we connect the Y to the families and hope that they'll sign up, you know.
And we've had a few families sign up after our group connections because they just didn't know that all of those amenities and interactive play areas for their children were available. So we have had parents, and then YMCA is able to give them a discount, depending on their income.
All right, next slide. So outcomes, these are things that we're seeing, and I did print off, every year we do a survey, and it is pretty extensive, and it is done through Boise State. They are partnerships with our HRSA grant, so they like to see positive outcomes coming from families. I don't know if any of you are curious, but I do have a lot of the main outcomes and actual comments from families that have been in the program. But overall, these are, like, in summary, what we're noticing. Healthy pregnancies and improved birth outcomes when we work with the prenatal mamas. Increased early identification referral services for developmental delay, vision and hearing. Increased parent knowledge of age-appropriate child development, including language, cognitive, social, emotional, and motor domains. Improved parenting capacity, parenting practices, their child relationships, and positive parenting skills. And then improved family health and functioning and by quality of their home. So all of these are things that we've seen time and time again when we do these surveys with our families. We do 2 surveys a year. We do one through the Boise State and then we also do a parents as teachers survey. So in general, these are the outcomes that we're hearing from parents. So all really positive things. That's why I think our program is so important, and we see positive outcomes constantly, and our parents are so grateful, and we hear it all the time, like, you've changed our life. Like, you've changed my child's life. What would we have done without you? That kind of thing. So, but in the end, we leave the parents feeling really empowered that they can do it once they've graduated and they've got the skills that they need to be able to continue for all these positive outcomes as well. That might be the last slide, but. Oh, if you guys are curious about the eligibility, it is, like I said, we have certain criteria that a family can qualify to be in the program, but we are really blessed in the way that we are not income restrictive. So low income does qualify you, but if you are out, if you do not qualify based on income, you can still qualify for other factors as well. So multiple children under the age of 6, first-time mom, for first-time parents. If there's any stressors in the home, like what you see here, they can still qualify for the program, which is really great because we're able to reach many more families based on just it not having to be low income. Any questions about that?
Sure.
Go ahead.
I think last month we heard from the Nurse Family Partnership. Is there ever an overlap in families where both entities or?
Sure. So we actually have had a couple families that want to do Nurse Family Partnership, but they might make too much. So they can come to our program instead. Or Nurse Family Partnership only goes to the age of 2. So once they graduate out of that program, they are referred over to us. So even though we follow very similar kind of curriculum, they go in once a week. We do, twice a month. So it kind of depends on what the family prefers. And then they have a very restrictive time frame that they can see their family, like when they can enroll them. I think it's up to
28 weeks of gestation.
And
So
if they're
anything
past
28
that,
below.
they refer them to us because we
Yes.
can take them at any time. But, and again, the income restriction on their end versus we don't have that.
And they can't be enrolled in Nurse Family Partnership together. So it has to be one or the other.
They probably technically could.
They could.
But it would be a lot for them. Like, that'd be a lot of home visiting. If they want that, they could technically because there's
Right.
and that's another thing too. For Nurse Family Partnership, it's a first time baby. Like for us, we can take multiple children. So if they're pregnant but they have an older kid, they can come to us. All right.
Sure. Do you have clients, very many, that are homeless with children?
Yes.
I
So.
can't imagine the challenge that is.
So usually, when we provide our services, we are not allowed in the shelters. So we are able to provide services for families who have been placed in a hotel, kind of like I've had a couple of families that have been placed in the Red Lion. We are able to provide services there. I had a family who had to go into a shelter, and we would do our visits outside, like in the park, just because we are not allowed in the shelters. But we have been servicing families who are in, temporary housing.
And up in Idaho City, the housing situation, I don't know if you would necessarily always consider it a home. It might be a temporary trailer, it might be a tent of sorts. So that does come up, but that's why we want to provide support. But we do accommodate and we do try to make them, we want to reach as many families as possible, especially very vulnerable families like that. We do have a room here at CDH that we're able to use if a family would feel more comfortable, because sometimes they're in a sober living home and there's a lot of people there and they don't necessarily want us to come to that home. So we can offer them to come here and we can visit with them here.
Cole.
I just want to say thank you for
Yes.
strengthening our community and the next generation. And just subtle endorsement for Shop with Cop. I've worked with them for years.
Oh.
So I think that's fantastic. So thank you so much for what you do.
Thank you.
Thanks for supporting us and the funding that we need to be able to provide these services. It's so important. And we just, I've been doing this for like almost 6 years now, and like literally just see the lives of these children changing and the families and the parents, or reunification instead of and getting out of foster care. And it's been really, or adopting into, an adoptive family. And that's been a really cool experience to see with a few families as well. So thank you.
Thank you.
Any other questions?
I was gonna ask, any other questions or comments?
Take your little thing if you want.
Yeah, she's been eyeing it since she walked in. Thank you very much.
Well, thank you.
Thank you.
Thank you so much.
All right, moving on, we have an action item, the emergency and non-emergency succession planning policy.
Okay, but you should have a copy of this in your packet, and the cadence for reviewing this is, the set cadence is when we do elections, which is coming up in May, for the board leadership positions, and those positions are held every 2 years, or when we have changes with the leadership positions that are outlined in here as far as the actual succession planning for the director position. So that's why we're doing it, is we did have a change, which is Beth Owen joining our team. November, what was it? 12th, okay, somewhere around there. So, and I think it's important, I know Commissioner Caldwell, this is her first meeting. And just so you all understand, the purpose of this is to have something in place that you all are aware of and agree to, so that if I am temporarily absent, either for less than 3 months or for more than 3 months or permanently, this outlines what those steps are and what the board's role is. So short term, like I said, is considered less than 3 months. And that's when we would have an acting director, and we have an order of longevity. So Laurel would be the person to step in as acting director. If it's going to be more than 3 months, so it's on the page 2, succession plan in the event of a temporary but long term, then the difference in that situation is the board would talk to Laurel about backfilling her position, because that would be a lot to take on, especially for a longer period of time. And then the next step is permanent. the director's not coming back, then everything that happened in step 2 would take place. Laurel would be acting. There'd be consideration for filling her position in as a division administrator, but there would be a transition and search committee to work on hiring a new district director. So that's really it. That's how the succession plan works. This policy is in existence. And on the very last page, page 3, you'll see the 3 division administrators in order of them stepping into the district director role. And then I don't know if you have questions or suggest changes. Otherwise, this is for awareness, but we would have the current acting chair sign it as well as myself, and then Laurel Curtis and Beth would sign this, agreeing that they understand this policy and what their responsibilities would be in case of absence, short-term or long-term or permanent, for the district director.
So if you're abducted by aliens, we're covered.
We could add that in here, because you don't know if that's short-term or long-term.
Well, that's how you communicate. How do you communicate? And I wondered about that.
Yeah,
He's out in the mountains a great deal.
yeah, I'll figure it out.
Yeah.
So, but yeah, this is just that process, so you are all aware and agree to it, and if ever does happen, then we have a plan in place to make sure there's continuity of the business and the operations, and a relationship maintained with the board, just with somebody different for whatever period of time that is.
Anybody have any other questions on this?
Is this an action item?
It is. Yes. No other questions? Anybody like to motion?
I would move to adopt the emergency and non-emergency succession planning policy.
Second.
A motion and a second, all in favor?
Aye.
Aye. Motion carries. Sorry. Moving on to the exciting part. Election for board chair. Can you walk us through the process, Russ?
Absolutely. So per your bylaws, if in the event of a board member or officer resigns or is unable to fulfill a leadership position, which has happened in this case where Al Hasbrook was a commissioner, he was also the chair, and then he didn't run for office, and Valley County chose to replace Al with Commissioner Caldwell. So the chair position is now vacant. So we have chair, vice chair, and then the trustee position, which obviously the vice chair is Commissioner Tucker, trustee / executive council member, which we have a executive council agenda item coming up, is Betty Ann. This election will take place by the board at the earliest opportunity to identify and elect a replacement for that position. So the chair position is vacant. Now, the only thing that's a little bit, I don't know how unique it is, this can happen anytime, but we have 3 more meetings. So we have the March meeting, the April meeting, and then the May meeting is when the elections will take place for all 3 positions to be held for 2 years. Make sense?
Yep.
So today, the position of chair needs to be filled.
Make nominations. Nominate you.
I'm the vice chair, though.
But we can make you chair real easy.
Then you'd have to fill a vice chair spot.
So actually, the trustee would be the 3rd in line. So if you were willing to do that even for a couple month period of time, if you weren't able to make it, there would be 2 more levels, but then Betty Ann would be responsible to chair the meetings until the elections in May to make the decision for the 2-year terms.
I sense some reluctance from Clay.
A little bit.
Dr. Furch if he'd be interested, if
I realize I'm the newbie, but I would be willing. I have some experience in running meetings and things that I'd be willing to serve if the rest of you would have me and the commissioners on the board would re-up me again in a month or two whenever my term is up.
We would have elections again.
May. Yep.
unless anyone else volunteers as tribute.
So we have, I don't know if we have two nominations. I prefer the second one. Would anybody like to second?
I'll second.
I'll second Dr. Birch's. That would be Dr. Birch.
Perfect. Okay, so we have nomination for Dr. Birch to be chairman and a second. I guess all in favor.
Aye.
Aye.
Birch,
Aye.
Any opposed? No.
We all voted anyway, so
Yeah, right.
however you would like it.
my wife voted against me for chairman of the Homeowners Association. Against.
My wife voted against me as chairman of the home.
You know,
That's standard practice.
That's standard practice.
Okay, I guess I have to keep running this meeting, but congratulations, Dr. Birch.
Thank you.
Thank you.
Next, we have an update on the executive council with Betty Ann Nettleton.
Okay, well, let's see, I'm kind of new back in this role again. I had a vacation of a few years. But there's executive council member from each one of the districts during the legislative session. Primarily, we meet weekly by phone conference, and the directors usually join us. And we have an update from the IAC person on what's going on in the legislature. And this year, it's a little different because we've talked about resolutions for everything for years. And so now we have, instead of resolutions, we have positions. And I'll let Russ elaborate a little bit on how that came to be, because our resolutions historically have been an idea that potentially would come to the legislature and we put into code. So maybe Russ can fill us in on how that came to be. But we have a number of things each week. The meetings have been extremely brief. IAC has brought up some topics that, have just come through the legislative conversations. And we started on the 4th of this month. And it's went from mask mandates, pot fines, public health district parameters, and there seems to be conversations about a lot of public health districts parameters. And we don't know what's going to become of that. Swimming pool inspections, which we talked about, and that since our last meeting has kind of seemed to maybe take a back seat. It's not of the priority that we thought it was going to be. Tobacco rules. Then we had perspective on recycling, which everybody talks about tires. I knew Crystal spent a lot of time talking about tires in their meeting.
If I could make water out of tires, Elmore County would be safe.
I remember when Fred Perez was out there, he talked about there was 1.5 quarts of oil recoverable in every tire. So I don't know that that's occurred, but that was when it first started, that tire doesn't see. Yeah, right, you won't either. So anyway, this House Bill 30, which became 202, was set to the floor for the second reading, correct?
Correct.
And has anything happened beyond that? I'm not aware of it. It didn't come up in our last conversation.
Mr. Chair, so 202 actually passed the House by unanimous vote, so it's going to be sent to the Senate Health and Welfare Committee. That is the one that removes the authority of the Department of Health and Welfare Director to create rules and do enforcement. And in a 24-page set of rules, it describes everything from construction, chemical treatment, and safety and signage. We are the regulatory authority, we as in the 7 public health districts. So once that authority is removed, which it looks like it will be, then starting on July 1, the rules will no longer be enforceable because there is no authority to have rules. So we will, I understand, be the first state in the United States to not have any government oversight for public swimming pools of any type. And there was some conversation among the district directors with the Department of Health and Welfare. Our preference was to pause making that change until the health districts have the opportunity to discuss this issue, which would be at individual boards, meetings like ours, and then at the Idaho Association of Local Boards of Health meeting, which probably will take place in October. Department of Health and Welfare has chosen to push forward with this, with the idea of, if the health districts are really interested in doing this, they can work with their cities and counties to adopt their own rules. And if they wanted the health districts to still be involved with regulatory oversight, then that would be a negotiation point between either a county or the city. So likely this will pass, and then starting July 1, there will be no government oversight of any pool of any type in Idaho.
Until those arrangements are made, county, district.
Correct. If Ada County, for example, wanted to create or could adopt the rules that are in place now and do that through ordinance, sometime, there'd be no change if it were done before July 1. Anytime after July 1, then there's whatever gap in time. But there'll be
So the counties would have to adopt a new ordinance.
Either the county or the city.
Or the city.
Okay.
Did you say that got out of the House unanimously?
Correct.
Well, yes, it did. We're experiencing a great deal of pressure, I guess, to put it mildly, from DHW to limit our parameters. Is that a fair statement? Yeah.
And then there's also Berlin daycare licensing too as well.
That one is to change ratios and let child care centers determine and what's appropriate based on their geographic location and, as I understand it, and staffing difficulties and things like that. So the idea is to make child care more available, but the question always is that, do you compromise something, right? And if you change, yeah.
And to keep an eye on those daycares.
We agree.
This week, we talked a little bit about, there's House Bill 136 on drug pricing, and it goes to talking about discount pricing for certain agencies that get the drugs, and the reporting process that they have to go through. And I'm not sure if that has progressed through any more of the committee, or do you know, Russ? Because this was just this week.
My knowledge
Yeah,
is not.
not to my knowledge, yeah. Then, like I said, House Bill 241, the Public Health Districts Board's parameters are really being examined closely, and it would take a lot of authority away from us. Is so. And that Senate Bill 1031, that also it addresses the district boards of health powers and duties, And there were some changes made in that bill, but Kelly didn't bring us up to date on those Tuesday. So I don't know if you're aware of any more recent since Tuesday or not.
Mr. Chair, to my knowledge, there's not, but the bill was sent to be amended and the amended version is not yet available, but as Betty Ann noted, it will change the powers and duties of district boards that's currently in 39-414.
In what direction or I didn't get a chance to read that.
Mr. Chair. So as it's written, but not yet amended, is instead of to say to do all things required for the preservation and protection of the public health and preventive health, it will say to take only actions specifically authorized by state law that are necessary and reasonable for the preservation and protection. And preventive health measures may be taken only in the case of a demonstrated immediate public health risk supported by scientific evidence. The board shall not engage in broad or arbitrary actions in the name of preventive health. That's basically what it is. And I saw a draft of the proposed amended changes, and the only thing that I saw that was going to be removed is the board shall not engage in broad or arbitrary actions. So if this were to pass, then you have to decide, that's where the debate always comes in, as you know, with laws, is how does that get interpreted and what is immediate and what scientific evidence do you rely on to make that determination? So I know, a lot of this is coming out of the pandemic and Board of Health authorities, and this will be a change in what authorities you all have. And then should something come up where you felt compelled to do something about that, in the case of some type of restrictions, there's already restrictions in place where it has to be heard. And like if this board were to say we're going to close, let's say there's a massive outbreak in swimming pools, like across a county, Ada County, where cryptosporidium, we have hundreds of cases, and you would say, hey, we got to pause here till we get this under control. As a board, you could do that today, but then Ada County would have to hear it within 7 days and say, yeah, let's go ahead and keep going with that, or they can amend it, or they can cancel it. So that's in law today. I guess this would kind of take it to that next step where you would have to say, we think it's immediate public health risk and supported by scientific evidence. Even with chlorination, we're realizing we're not able to get this under control right now. People get sick, hospitalized. And then if you do that, you could then be challenged based on, well, what scientific evidence are you using? I'm just envisioning that that's kind of how this could play out if it were to pass. Ultimately, you would make the decision that you thought was appropriate. And then I guess, like all clearly written laws, there will be litigation to determine whether or not you were right.
So another thing that just briefly came up, we talked about our food legislation fees for years and how we're really getting the shaft and that we've got, in our district, how many thousands?
We do 4,000 inspections per year.
At a loss of how many dollars per each? I can't remember.
Yeah,
it's huge.
Right.
It's huge. But the lobbying over that is what you might call is super powerful. Doesn't look like that's going to go anyplace again this year. So there was a little bit of discussion on an ambulance bill where it moves the management from the Department of Health and Welfare to more military standards. And I don't know if that has progressed to you yet. So, and that brings us up to the last meeting, which was this Tuesday. But the Director of Health and Welfare, Alex Adams, seems to really be pushing on the parameters of duties for the health departments. So, Russ, you want to talk about the position and resolution discussion, what that really means?
Sure. So, and as Betty Ann noted, she got a brief break and being responsible as the executive council member and trustee, and now she's back in that role. And so resolutions, the boards of health, 7 of you, about 54 members, would meet once per year. That often took place in June, and this year, for the first time, it took place in October in Idaho Falls. Next year, it will be moving to Public Health District 3 based in Caldwell. And it's so clearly it's not a clockwise or counterclockwise. It just kind of, and I don't know how that ever got established, but it's been in place for as long as I've been around. One of the duties, one of the things that association does, like all associations that are involved with, like the Idaho Medical Association and other groups, they pass resolutions, things that they think would be important from a policy perspective. Also included were we support good mental health. Okay, so that was written as a resolution, but there wasn't any specific action with that. So that was a change that occurred this year, sort of spontaneously at the annual meeting, which you were all, or Dr. Perch and Commissioner Rogers was there, along with Elle, is, well, we should just make these position statements. So one of the ones that we brought forward was WIC, like we've been asking for data from health and welfare to marry up eligibility determinations for other social support programs like SNAP and Medicaid, which would make you automatically eligible for WIC if you're pregnant or have a child up through age 4. We don't know who those people are, but we do know from national data that it's less than half of WIC eligible families participate. And just like with parents as teachers, that's a prime example of it's not just about WIC and nutrition education, breastfeeding promotion and support, but getting families connected to other community resources that are really valuable, like parents as teachers or nurse family partnership. So just putting that out there because that made sense to make it a position statement versus a resolution to cause some type of policy action. So that's kind of the long and short of it. But the challenge is often what actually gets done with those, even in case of policy. In the past, the Idaho Association of Local Boards of Health has been agreeable to hire a lobbyist and use money to have somebody advocate on the local public health district's behalf to push a policy forward. It's only happened a few times in my time with the health districts, and it's been around fees for food establishments to get them raised, because once they're set in code each year with inflation, and it shifts more of that cost burden onto the counties. It used to be the county and the state. House Bill 316, no more state general fund, the general appropriation. So it's picked up by the counties today. But as those of you who were at that meeting, there were sort of conversations about it, and then we all pack our bags and go home, and then nothing happens. And that's what's happening this year again. Idaho Association of Counties, we do pay them, the 7 health districts, but primarily what they've always done is they track legislation and keep us informed, but they don't generally take positions on issues of public health significance that the association has voted on. So if there's anything that could be done different from where I sit, is if we're serious about changing policy, then we need clear direction and we need to put some money into it to help somebody who's skilled at lobbying advance those bills forward. So that was bigger than the position statement, but it was more the differences between a resolution and a position statement now, as spontaneously introduced in October. And then what do we do with those moving forward? And it can be a challenge, just like with pools. I'm not sure where people are at. Like, we have 54 Board of Health members, 60-some% of them, or 65% are county commissioners. And when these things come up, is it consensus from the boards? Like, you think you would like somebody to pause on this so that we can take some time and evaluate what makes the most sense? And in absence of that, these bills just proceed forward, and the outcome is, in this case, no more regulatory oversight for pools, or in the case of 1301, boards of health powers and duties will change. As a result of that, and there's no one that, like the executive council, there's a conversation takes place, but there's not really decisions being made to say, this is what we want IAC to do on our behalf, or this is what we want Joe or Sally Smith, the lobbyist, to do on our behalf. So just something to think about, I think, for this coming annual meeting is, are we good with this? Whatever happens, happens, we live with it, or do we want to take positions and then put some money behind it and try to influence the decisions that are being made on our behalf?
To me, it really waters down what we may be serious about taking forward.
Yeah.
It really does. District 3 is, of course, where IAB will be this year. Well, it's District 3's turn, but they're remodeling their facility, so we may end up hosting some of their things here, correct?
We offered the rooms across the hallway. They're going to do all the planning, and we would just be offering space, and that seemed to be their preference. There is a survey going to be coming out, which you'll get it from me, to determine things like dates and location. Do you want to meet? Do you want to, just what are the parameters? What are your wishes around the annual Association of Local Boards of Health meeting? There's always a discussion. Is it needed? Want to meet? Is association needed? I don't know that that'll be in the survey, but it'll probably come up on the agenda in October.
Do you have the date for that?
Yeah, Chair, no dates yet. So, yeah.
Back to your last point. So in terms of resolutions and lobbying and whatnot, would that be one lobbyist for all the health districts?
Mr. Chair, that is how it's been done in the past. Yep. So it's actually, this point in, it's not that expensive when it's shared by 7 public health districts. Yeah, because it can be pricey, but at the end of the day, when I was involved in 2009 with the food license fee change, we paid about $15,000, and it generated almost $500,000 in additional revenue for the 7 public health districts. So from a cost perspective, and that reduces taxpayer burden, it's kind of a no-brainer, but it just has the conversations that take place. And if it doesn't move forward at the annual meeting, then it's done, because there's no other opportunity for all of you to weigh in and decide collectively, is this something we want to do? Not just all of you here, but the 54 members statewide.
Unless individuals go to the public hearings on each bill.
Yeah, and you could do that with the backing of a position statement or a resolution. I mean, I don't think if you went to support food establishment license fees, let's just say that became a bill and you did that on your own, I think it would be totally appropriate to do that, because the association has voted on that. If some other bill comes up and you went that there's no resolution or even a position statement on,
it just goes a private citizen.
Precisely. Yep.
Well, if the organization as a whole doesn't ever progress with anything, it just seemed like that was kind of a big hurdle for them to do. Is it uncommon for a couple of the health districts that have some buy into things? Obviously our health district has a lot of pools.
Yeah.
And maybe 3rd district or whatever. This is something that
be, I guess, thought of as a lobbyist just for those individual health districts, that the other isn't going to.
Yes.
Yeah, Mr. Chair.
The funding formula comes from crisis to the top of that one.
Yeah, so we have done that where we're not in agreement with other health districts. In this case, it was a distribution formula for the state general fund appropriation, which was over $10 million. And Betty Ann will recall, because she was directly involved in that, it was a very contentious issue, and we were
Very.
way out of alignment with what we thought was appropriate. So we hired our own lobbyist to help with that. Ultimately, it was resolved by House Bill 316.
Right. It was always a 6-1 vote, and I was always the one.
Yeah. Yeah, it was very predictable, the outcome.
So no, we don't always agree.
Yeah, so that's a good question, and that's something that, you know, maybe we'll have more conversations in the fall with this board as far as what we want to do, see what the outcome is at the IAB meeting, Idaho Association of Local Boards of Health meeting, assuming that takes place. And then if I regroup in December, that's when we would meet next. I guess it depends on what, because we meet October. If it's before that, we can make a decision, or make a decision in December if this body would choose to move forward with a lobbyist to represent us. And quite frankly, I don't know that it's a bad idea to have, you know, the person all 7 health districts used was Mike Kane, and he didn't have a, you know, $50,000, whether there's any bills or not. He only charged us when he was working actively lobbying, which is, I think, a pretty good deal. Like I said, $15,000 compared to what I hear other lobbyists are getting paid. And that was just based on what his costs were as accumulated throughout the legislative session to advance policy. But I mean, it's a big deal. I mean, boards of health, you guys are the ones responsible for things like setting policy for around public health issues. And I'll put it out there. I don't know that it's going to come forward, but it just, I worry with the expediency at which the pools will be removed from regulatory authority, and the childcare rules are being proposed to be changed. And we do 4,000 licensed food establishments per year. What's next? So just keep that on your radar. There's no indication, but if the trend would continue from a public health, public policy standpoint, I just want you to be aware of that. And of course, Betty Ann and I would keep you all informed. But I feel like we sometimes are well back on our heels when these things come forward.
Yeah, keeping a close eye on the future of the public health districts and the conversations that are going on.
Yeah. So.
Anything else, Betty Ann?
No, that pretty much brings me up.
Thank you for the update.
Mhm.
Moving on to the director's report.
All right, well, thank you. So we're getting ready to start the budget setting process. And Commissioner Caldwell, this will be new to you, I assume. So I'll just do a quick overview. So we meet in March, April, and May. And in March, I'll come to you with our preference for pretty much 2 things that you directly influence. I mean, you directly influence the whole budget, but when we're building our budget, what we talk about is the county contribution. And then that's about 30% of our budget overall, the total county contribution. And are we going to increase that, and by how much? And then part of that is a conversation about staff salary, which personnel costs is about 70% of the budget. So I'll come to you in March and say, this is what we would like to do. And you can say yay or nay, or give other guidance. We're looking for guidance at that meeting. And then we will build the budget based on your request. Then at the April meeting, that's when we'll go through the budget based on the parameters that you have defined for us. And I will ask for your approval of that budget. After that, I meet with each of the board of commissioners, and if you're not a commissioner, you're always invited to come and be part of that conversation. And it's always good to have board members there who are not commissioners if you can make it. That's informational, answer any questions. And then in May is when the budget committee will meet. This year it's in Boise. It rotates from county to county. So this year it'll be here. And Chairman Beck will preside over that meeting as the Ada County chair, Ada County Board of Commissioners chair. And it's by simple majority vote whether or not that budget gets approved or not. That's the final step, is the budget committee. And if it's a 3-1 vote, the county who says no still has to pay. And that's in Idaho code. If it's a tie, then we have until the first Monday in July to come back with a different budget and have the budget committee reconvene. So there's time to make that happen. We've not always had a unanimous support, but we've always had at least 3 of our counties voting in support of the budget that the board approved at the April meeting. So be thinking about that. That'll be on March 28th is when we'll meet, and I'll see here's what we'd like to do. And you all say, sounds good, or, well, our preference is this, and then we proceed accordingly. Any questions about that? I know some of you have been through this a few times. Okay. The last thing I wanted to bring up is, I know all of you are very well aware of what's happening at the federal level, from funding pauses to large layoffs that are occurring. And we do receive a lot of federal money. That's like the WIC program is funded by the United States Department of Agriculture. So when that pause early on was being proposed, then it creates a lot of anxiety, understandable for all of us working in local public health, because of the impact, the direct impact, not layoffs directly have, but the funding streams that come to us to allow us to do our work. But there's more to it than just at the federal level, because even if they provide grants to the state, most of those come through health and welfare, through the Division of Public Health. The legislature has to provide spending authority for those funds. So at this point, in fact, it's being heard today, the public health budget, we don't have any knowledge whether or not there'll be cuts made to it or not. And we'll presumably know later today whether or not JFAC has approved spending authority for federal money that's in the pipeline. So I know when staff hear this, no matter where you work, any publicly funded, grant funded sector, it creates anxiety, and people want to write about their jobs. And but again, I want to emphasize, at least as of this morning, there's no indication that things are going to change for us, but that could happen today. It could happen sometime later this year if there's changes to grants coming to states. The good thing is, as you know, because you set it and approve it, is we have a really healthy operating reserve, 3 months of our total budget. So let's say there was a temporary pause on funding for WIC. We could keep that program going for a period of time. That would be definitely a discussion we'll have with all of you before we start drawing down on a reserve account. Historically, what's happened is anytime we've been faced with that, we've never had to draw down on the reserve, but almost always what you see happen is there's appropriations come in and it sort of backfills any shortfalls that we might have had. So it's not permanent that we have spent that money with no ability to collect it back, but it could happen. So yeah, so I just want to kind of give an update. And I think we're going to do next week town hall meeting just to allow staff to come in and share their concerns. I'm gonna send an email out after this meeting to let staff know, and then probably do something a month or so from now, once the Idaho legislature is done, and we see the results and be able to share with our team what the impacts have been. Any questions on any of this?
Right now, go ahead.
Mr. Chair, well, a couple of things. Funding definitely is an issue, but also we should put on our radar screens, there's probably going to be some, policy changes that might have ripple effect down. The Department of Agriculture, the new secretary has already talked about maybe ending things like subsidizing, soda and donuts through the SNAP program and things like that we're probably going to be having an impact. And I know through the state and the SNAP program and its administration here. So the world is changing in a lot of places and in a lot of ways in DC, and some of the policy parts are going to have an impact on us also. And then one more thing before we gavel out, I would like to just maybe publicly thank Commissioner Hasbrook for his time and, his 10 years chairmanship. And I don't know if you would just take a minute and, his timeline a little bit, but just share when he came on and how long he's been.
Yeah, so it was, I think, November of 2014 is what I have in mind. So, yeah, and I think about all the things that have occurred during that period of time where we had the state general fund formula, and El, as a commissioner at the time, he was part of those conversations and was the one vote for a few years when that was being decided. And then, of course, so that was a big change. He helped, guide what I think was a great bill, House Bill 316, and really gave a lot more authority to the boards of health to operate and oversee the agencies, which was cool, which was really good. And the funding is now being picked up by the counties. At the same time, the county indigent fund was being, phased out, so there wasn't the huge cost associated with that. He was also the chair during the pandemic, which was an incredibly difficult time to go through, whether you agreed with decisions and what was going on or not. It was the boards of health throughout the country were faced with immense pressure and decisions that are, I feel like, still reflected in legislation, despite the fact it was 5 years ago. And I think just his, my thought was just his consistent, steady hand. He was always so calm. I never saw El get worked up about anything. And he was always just, he was a really good guide and mentor for me, because I tend to get more worked up about things that impact public health or our staff. And he would always be willing to take the time to speak with me in person or over the phone. And I just always appreciated that. And I think he said it, and I think if he was here, he loved being on the Board of Health, and believed in the mission. And he came to our all staff meeting last year as the chair and spoke and told stories about his own experiences as a younger man with interactions with public health. I won't go into the details, but anyway, I guess. Yeah, he just was a great person, and it's a big commitment, 10 years. And I appreciate you bringing this up, Dr. Furch, because it's we didn't get a chance to recognize.
Yeah, there's no going away part here. Just his pictures off the wall.
So yeah, good man. I don't know if any of you.
I'll just second my gratitude, because we had a great hallway conversations.
Yeah.
Agree or not agree, he's a super good guy.
Yeah.
Anything else?
That's it, Director.
Yes, we'll open it to public comment. there any public comment? None? Well, if anybody doesn't have anything else they want, I will adjourn this meeting. You are adjourned.
Thank you.
Thank you.
Get that, I mean,
Yes, yes. Yeah,
rock and rolling.
yeah.